Have you ever wondered how doctors can truly see the impact of gluten on your body, especially deep inside your gut? An intestinal biopsy for celiac disease primarily shows specific changes and damage to the lining of the small intestine, especially the tiny, finger-like projections called villi. In individuals with celiac disease, consuming gluten triggers an immune response that mistakenly attacks the small intestine. This immune system reaction causes inflammation and leads to the flattening or shortening of these villi, a condition known as villous atrophy. Since villi are essential for absorbing nutrients, their damage can lead to various symptoms including nutrient deficiencies, bloating, and fatigue. Pathologists carefully examine the tissue samples under a microscope, looking for several characteristic features such as villous atrophy, increased intraepithelial lymphocytes, and crypt hyperplasia. They often use a grading system, like the Marsh score, to classify the severity of these changes, which is vital for confirming a diagnosis of celiac disease. The biopsy procedure is typically performed during an upper endoscopy. During this outpatient procedure, a gastroenterologist uses a thin, flexible tube with a small camera to visualize the upper digestive tract and collect tiny tissue samples from the small intestine. These samples are then sent to a pathology laboratory, where a trained expert meticulously analyzes them to identify the unique markers of celiac-related intestinal damage. This detailed examination helps differentiate celiac disease from other conditions that might cause similar symptoms. A crucial detail for anyone undergoing this test is to continue eating gluten regularly before the biopsy. If you switch to a gluten-free diet too soon, your intestinal villi might begin to heal, making the telltale damage much harder to detect and potentially leading to an inaccurate or misdiagnosis. Understanding what an intestinal biopsy reveals is key to a definitive celiac diagnosis, empowering you to make informed decisions about your diet and embark on a path toward better health and symptom relief.